So this is our cardiac MRI imaging technique at the MGM New Bombay Hospital in Vashi. We have the 3 Tesla Philips MRI. It's one of the highest end MRI scanner for doing cardiac CT. We have dedicated hardware and software for processing the cardiac MRI. And you can see this is the main console from where we start imaging the patients, and you can see the surveys or the initial part of how we look at the images of the heart. And the advantage of cardiac MRI is that we start looking at the function, not just the structure of the heart. And the images will show how the cavity of the heart is, how the muscles of the heart are, how the valves are. And through this structure, once we finished the first phase of the scan, which is called as a plain scan, the second part of the scan would involve injecting the intravenous contrast called as the gadolinium. And that's done through this injector. This is an automated injector which decides how much dose we are supposed to give. And once the contrast is injected, then we get the entire images that tells us about the structure and the function of the heart. Once we do that and all the images are gathered, then we have an excellent software called the Sweetheart from the United States, and now you can actually see what I'm doing here. So this is the AI generated contractility of the heart, and you can see now, just like you see in echocardiography, but this is far advanced, various aspects of the heart. Not just that, once we process the images further, you get an idea about all the images of the heart, how the functioning of the heart. For example, if I point out here is a patient with what we call as EF66, means the contractility of the heart is normal. So this is something we always look for, and then we see on the images one after the other how the heart contracts, how the muscles of the hearts are, right? And a lot of information can be gathered from this viewpoint. There is an excellent delineation of the various chambers of the heart and how the muscles of the heart get separated out. The technique also allows us to look at how overall the function of the heart is. For example, in this particular image, we see that there is no real abnormality in terms of the muscles of the heart, in terms of what actually is the damage. All these complicated graphs that you are seeing basically helps us to understand whether the muscle of the heart has got damaged or not damaged. Has it thickened? Is it showing a swelling of the muscles? That's called as myocardial edema. Is it damaged? Are there scars in the muscles? So various aspects of all these parameters are looked at, and this, for example, sequence helps us to understand whether there is a swelling of any portion of the muscles of the heart. Cardiac MRI goes a long way. It's complementary to our cardiac CT. Once we have the CT images that shows the arteries and the various parts of the heart, and then we go to cardiac MRI and we study the function of the heart, that in toto and in reality becomes the entire understanding of the heart.